Let us talk about one important aspect in ocular examination, the examination of the pupil. While examining the pupil, you need to look at the size of the pupil. Under normal illumination, it would be about 3 to 5 millimeters. The shape, which is circular or round, you compare the shape and size of the pupil and make sure they are equal on the two eyes. If there is an inequality, the condition is called anisocoria. We also make sure that the pupil is located in the center. And then we record the pupillary responses, the response to direct light, check for consensuality or the consensual light response, and check for the response to accommodation. In order to examine the direct pupillary response, we preferably do it in a dim light. We have dimmed the lights here. We hope that you will be able to see the response. You ask the patient to look far ahead. Subsequently, you shine the light into the patient's pupil and see how briskly the patient's pupil constricts. We then move on to examining the indirect or the consensual light reflex. For that, you may advise the patient to partly block the light. You may do that yourself. Now, you shine the light into the patient's pupil in one eye and see the response in the other eye, and you will notice here carefully that the pupil constricts in the fellow eye. Keep looking straight, Mr. O'Neill. So the pupil is also responding to consensual light reflex. We now record the pupil's response to accommodation. I want you to look far. Now, please look at this, and as you move closer, you would see that the pupil constricts. Next, we move to what is called performing the swinging flashlight test in order to detect a relative afferent pupillary defect. I want you to be looking straight. In rapid succession, you swing your flashlight from one eye to the other. And in a normal person, what you would notice is when you shine the light in 2 seconds interval, the pupil constricts as you move from one eye to the other.